let's go ahead and get started. Thank you so much for attending today. This is a presentation presented by Bravo here at UMB. So you can see here on the screen that it's a UMB presentation for UMB Financial Corporation presented by Bravo Wellness. Bravo is our provider and vendor to manage the incentive administration this year. So they will be taking all the information as it relates to our wellness program and then communicating with all of our associates about their status in the program. So let's go ahead and get started. As you can see here, we'll talk a little bit about why wellness. So in the big picture of things, chronic diseases related to lifestyle activities account for 75% of national medical costs, according to the CDC. And the same is true for our population. So kind of as it shows here, over the last 5 years, employers saw a 34% increase in healthcare spending. Employees saw about a 40% increase in their contributions to healthcare. And again, you kind of saw the same thing. We had a little bit of an increase in our premiums, and associates felt that as well. So the behavior economics work by incentivizing our associates to be healthier and make better decisions when it comes to their healthcare costs. That will reduce their expenses and then thereby reduce the company's expenses, which again reduces their own expenses again. So by working together, we can really curb this thing. Heading down an unsustainable and destructive path, we're not harming ourselves, but we're also the generations to follow. If we continue to utilize healthcare in the same way that we have, then expenses keep going up, medical inflation keeps going up, our costs keep going up, and the lifestyles that we start to build is becoming regular and more used to become more acceptable, and therefore those costs start becoming regular costs of living and therefore more costly. But all working together, like I said, we can curb that cost. So, if someone stays compliant on their medication, takes care of themselves, or does their preventive care work, that lowers their costs out of pocket. As a group, we all lower our costs, and so our premiums go down, and then for you have a little bit more savings in your pocket again from reduced premiums. And that's kind of what it means here by UMB recognizes this and asks for your help. If you participate in the program, you take responsibility, you do what you need to for your health. You also inspire others to do the same, and we all work at it together to reduce our costs. Ways to offset medical plan cost increases. Different you can do as an employer. You could raise premiums, you could raise deductibles, you could raise co-pays, you can eliminate or reduce benefits. And as you guys have seen, we've done some of that to some degree in different years. But one of the best ways that we can do this is by addressing what's causing the increase in claims, and that's our health style. So that way we don't have to do things like raise premiums and deductibles and co-pays. Instead, by working on improving our health, we get at reducing the costs without having to do some of those measures. So, as I said, Bravo is administering our wellness program, and we'll work on notifying you when you receive that incentive. So just like good drivers pay less for car insurance, homeowners pay less for home insurance when they have smoke detectors in their house, non-smokers pay less for life insurance than smokers do. By participating in the voluntary wellness program, you can earn incentives and therefore, have a better rate. Who is Bravo? Bravo coordinates the voluntary program here at UMB, and they reward you for your healthy lifestyle choices according to the program that we have in place. The administering that program and implementing any of the incentive activity for us to help offset those rising healthcare costs. They were established in 2008. They're headquartered in Cleveland, Ohio. They have about 155 employees, so it's a small team, but they are very good at what they do. They're a leader in participation outcomes and improvement-based wellness incentive programs. So even though the team is small, they are very efficient in what they do, and which is why we chose them to partner with this year to make sure that our associates had a better experience for our wellness program. Be rewarded. Participate in the health screenings for things that's going to measure your blood pressure, your body mass index, LDL cholesterol, total cholesterol, glucose. And tobacco use isn't measured in the health screening. It's done during the registration process when you attest on the registration process to your status. But those are the ways that you're rewarded in the program, by those 5 measurements and the tobacco separately. If you meet 3 out of the 5 health targets, you'll qualify for a wellness incentive to reduce your costs. The screenings are performed on-site once per cycle, and all results are 100% confidential. Separate tobacco-free incentives are based on your attestation of your tobacco-free status, or if you're participating in a cessation program, you can attest and still earn the tobacco-free incentive by being enrolled in a cessation program. Waist measurements can be requested as an alternative to BMI. So those who have a BMI that are over 30, but your waist measurement is in line, that automatically still qualify you. So as long as your waist measurement is in line, you would still achieve that category. If the measurement is not attained, then you can appeal or complete an alternative to still earn your incentive. So look at these categories, and there's some data here that kind of shows you on a nationwide scale why we would look at this. For example, under BMI, it says annually an obese individual costs about $1,100 more than someone who's at a normal weight. For blood pressure, an individual with hypertension costs about $1,400 more than someone without, and so on for cholesterol, tobacco, glucose. And so when you start looking at those costs, a lot of this can be affected by lifestyle. And so if you were personally to get yourself in line, you'd save yourself, $1,100 by getting your weight under control, or $1,400 by kind of getting those hypertensive symptoms turned on and really taking care of yourself. And so when you start saving those types of dollars individually, and more people across the plan start saving those dollars individually, that reduces the claims cost on our plan, and therefore reduces the expenses that we have to pass on for premium costs. And so if we all work at this together, and everybody can costs on the plan as well. So it can be big dollars. I mean, look at the cost there of tobacco products. Someone who uses tobacco products costs on average about $5,816 more than someone who doesn't. So while it's a really hard road to quit and work at, it can be a substantial savings not only to the individual but to our costs on the plan as well. How the plan works, you'll go onto the Bravo site, www.bravowell.com/UMB, and complete registration. The application went out last week to ask everybody to register, and for the first time out there, everyone will have to create an account since this is our first year at Bravo. You'll schedule your screening through the Bravo site. You'll complete your health assessment through MyCigna, and that will be passed to Bravo to mark your of your health screening, and so that will allow you to view your results for both your metrics on the site, and also to show that you've completed your health screening, so you can know what your incentive status is just by logging into the Bravo site. They'll also have access to tips and resources to become more active and single site, so that you can access some of the things that we have on our site, and on the Benefits Resource Center will be linked across there as well. To protect health screening, we will conduct our health screenings in the on-site locations like we have in the past. They will do a blood draw to determine your cholesterol and glucose, and it will be a full venipuncture blood draw. It won't be a finger stick this year. So something to consider when you're trying to schedule your appointment of whether you're wanting to do it here on site or whether you want to do it with your physician. They'll also check your blood pressure, your height, weight to record your BMI, as well as do the waist measurement. Blood tests occur clinically with one opportunity for you to appeal or retest within 30 days of receiving your results. So if you do your screening and something is out of line, you can always appeal that and have it redone and replace that reading. Be sure to drink plenty of water prior to your screening. If you're dehydrated, it can flaw your results, especially with things like cholesterol, so make sure that you're aware and drink lots of water right before your screening. When your results are calculated, Bravo will send you a results letter to show you how your goals compared to or your results compared to the employer goals, how your results compared to national health standards, and what credits you've earned. The results letters will be available through the portal and can be shared with a healthcare provider if you need to. You can take your results letter or you can print it off from the portal and work with your doctor to make that improvement. Benefit for you, the program is completely voluntary and confidential. Everything that, all your health information that is provided to Bravo for the incentive is not shared with UMB. We only get aggregate results. It doesn't say Becky Moody's BMI is whatever. It basically just says I've achieved the incentive or I haven't achieved the incentive. Potentially reduces your cost for health benefits because you earn your incentive, so you can reduce your premium costs, rewards you for living a healthy lifestyle, since those measures that we're looking at would be before a disease state. You know, it rewards you for being pre-disease, and then obviously for making changes to get here. It rewards employees who minimize their risk for serious medical conditions like we just talked about. Alternatives are available if you can't reach your goal. So if you're not able to achieve the goal, you still have the opportunity to earn incentive by setting up a reasonable alternative with Bravo. They'll set the goal. Usually they have about a 60-day turnaround, so they're going to help you set a goal that is reasonable for the amount of time that you have. So they're not going to allow you to say, I want to lose 50 pounds within 60 days, because that's not feasible. They'll work with you a little bit more on what would be reasonable and go from there. It does allow you to participate if you're on medications to control your health. So if you're on a medication and you're doing the right thing by keeping yourself on your regular treatment schedule, that's fine. As long as you're taking care of yourself, that's the main goal. It also keeps aware of your current health conditions. Year over year, when we have the health screenings on site, we continue to get people who will use their hand and say, hey, I didn't know that I was at risk for diabetes, and I went to health screening. I hadn't been to my doctor forever. You know, I went to the health screening and found out that I was pre-diabetic. Now I have the opportunity to make some changes and not develop diabetes. You know, that's very powerful in somebody's life, and that's kind of what we're after here. So these are our goals, and we shared them with you during annual enrollment, but just as a reminder, this is what we're looking at when we're saying you need to meet 3 out of 5. So body mass index of 30 or less, and then waist circumference for men under 40 inches, for females under 35 inches. Blood pressure under 130 or 85. For LDL cholesterol under 130 milligrams per deciliter. Total cholesterol under 220 milligrams per deciliter. For glucose, we're looking at either below 100 milligrams per deciliter, or a HbA1c of less than or equal to 7%. And that HbA1c is a reading of your glucose level over like a 90-day period. So it won't be as to fluctuate, like your glucose would be. So like if you ate some really sugary, like you ate, some fruit right before you went in and did your screening, recommend fasting. Let's say you do eat some fruit and you go down and have your screening done, your glucose level could be significantly elevated, even though, on a regular basis, you're okay. So the HbA1c testing automatically kicks in to see is it something that's just fluctuating because of what you ate today, or is it something that's consistently high for you? And like I said, the tobacco incentive is there, saying negative, meaning that you don't use tobacco products, and that will be done through the attestation during the registration process and not directly at the screenings. And then, like I said, over on the right-hand side there, you can see the National Health Institute standards, and you can see that the levels that we're looking at are below what those health standards are for the most part. So asking you to be the picture of health today, but at the same time, we do have some levels in place that are before you would get to a full-blown disease state like hypertension or diabetes or what have you. As a note, just a reminder, if you do earn an incentive for 2 consecutive years when you're eligible, the non-participation surcharge does still apply. So as a reminder, like if you didn't earn an incentive here for 2015 and you don't earn an incentive for 2016, you'd kick in the surcharge for 2016. So something to think about as you're kind of going through things. The full directions on how to access the portal are available on the internet. It will soon be out there on the Benefits Resource Center. You got them in the email last week to tell you about the portal being open. And then if you have any complications with the site or anything like that, Bravo is available to help you with that. You can call them, and they have a bilingual call center available to help associates work through those technical issues. A quick sample of what the results letter will look like. Results will be mailed directly to your home. You'll be able to see, what goals you've passed and what incentive level you've reached. It'll also show you, what the national standards are and give you information about how you can do an appeal or reasonable alternative if you need to. So you can kind of see there's the first letter, the first page of the letter that will tell you kind of what program is and what to expect. The second page will show you your results. Then the third page will show you kind of those national health standards and how to do a reasonable alternative piece. So the screenshot of what the portal looks like. So if you go out to www.bravowell.com/UMB, this is a page that will come up. Everyone's first time out there, they'll need to create an account since this is a new process for us. After you created an account, you can just go straight over there to the right on the green login and log in from there. The next page that comes up after you hit create an account asks you to enter your information. It asks for your legal name, and so for people like me who have a different legal name than a nickname, you need to enter your legal name. So for like me, I'd have to enter Rebecca instead of Becky, and then your legal last name, date of birth, and the date of birth thing has a bit of a wonky feel to it in that you do have to use the arrows to arrow over to get to the year that you need to, and then month and day as needed. So just be aware of that when you're going out there, that it's a little bit funky. It won't let you just type it in. You do have to use the little arrows to slide over. And then you'll enter the last 4 digits of your social, so basically to match you up to make sure that you're creating your account and you're in their database to make sure that they're getting the proper results connected with you. And then you'll hit continue. And to the first dashboard, this is what you'll see when you log in. It'll say, hello, your name, so hello, Becky Moody or Rebecca Moody. And then it gives you your 2 steps. First, complete registration. Second, complete your screening. So you'll click on the employee registration to get started. and work through the registration page again, confirm your name, date of birth, gender, your home address. And there's also an option here that allows you to receive text reminders, so you can opt into that if you like. At the bottom part of the registration page asks you for your current enrollment level, and then you'll see there that there's the nicotine. I have not used tobacco nicotine products in the last 90 days, or I have used tobacco nicotine products in the past 90 days. This is where you'll attest to your tobacco status for the separate tobacco-free incentive. So just make sure that you answer that question as you go through. It is required in order to submit, so you'll want to make sure that you attest to that as you through. And then they'll ask if you're having a spouse or a domestic partner on the plan. You'll fill in their information. They've got the participant notice and consent, HIPAA information that your information is held private. It's completely confidential. They're not sharing it with us. So you're voluntarily setting up this account, and they'll contact you directly about any issues. The process for the incentive process, you need to complete your biometric health screening by November 30th. Whether you go to an on-site screening, our screenings will be loaded here in the portal shortly here in March so that we can sign up for appointments, and then the screenings will happen in April. You'll schedule your appointment through the portal directly on the Bravo site, so you'll need to make sure that you've registered and go out to the site to schedule your appointment. You do have the option to go to your physician. If you currently click on that schedule a screening appointment, it will take you out there. There's no screening appointments loaded. There will be the physician's form that you can click on and pull that off the site to take to your physician now. And it will still be available once the screenings are loaded as well. Again, it will pull up all the screening dates and allow you to choose your appointment, or down below you'll see that physician's form is still available that you can pull it off the site. Another step that you'll need to complete is to complete the online health assessment. Again, it needs to be done by November 30th. You'll log into www.mycigna.com and complete your online health assessment on there just like we had in the past. Notification of your completion will be sent to Bravo to update in the portal. That information is coming over from Cigna. Information from Bravo is not going back to Cigna. So we're not sharing it both ways. That we're just sharing the completion of the health assessment to Bravo, and then Bravo's not sending your results back to Cigna. So something to be aware of. If you don't meet at least 3 out of 5 biometric targets, you'll need to contact Bravo to request an appeal or an alternative. And again, that needs to be completed by November 30th. So you call Bravo to set your reasonable alternative. Once your goal is set, you can work with a coach or with your physician towards achieving that goal to still earn your incentive. It brings up a good topic of talking about wellness coaches. You can work with your wellness coach towards achieving your goal. Cigna's integrated personal health team provides you that telephonic coaching and support. You're able to access it 24 hours a day, and your IPHT coach can help you stay on track and also help coordinate care for better results. So if you're needing to find a physician to help you achieve your goal, or you're working with somebody but you need to find someone else in network to work with, they can help kind of coordinate that care for you to make sure that you're staying in network and getting the best possible results. And the wellness coaches, SA coaches, or on-site coaches, provide that in-person coaching opportunity. They also will work with you telephonically if you need to, and they can provide advice on a variety of health topics as well. And the other thing about the WACUTA coaches is that because you meet with them in person, they can test some of your results to complete goals for things like blood pressure and BMI waist circumference. So that is a free option for you as well. Additional information, and this is just some information about how you can access different tools and resources. Obviously, Bravo Wellness's phone number and their website, the BMI calculator. So if you're kind of wondering where you stand right now, you can go out and calculate your BMI now. Smoking cessation resources available, weight loss information is available through the CDC there, and then cholesterol management through the American Heart Association at heart.org. we'll open for questions. First, we'll open it up in the room here, and then on the phone. So we'll take some questions. Yes. Okay. Do spouses have to do the same thing as the associate and work with Bravo and open up a separate Bravo account? And the answer is yes. The associate and the spouse or domestic partner's experience will be exactly the same. They can earn the same incentive level. They are looking at the same targets, and so everything is separate. The associate has an account with Bravo. The spouse or domestic partner has an account with Bravo. You'll do screenings the same. You'll complete your goals the same, and you'll earn incentives the same based on your individual information. Okay. The position form currently says that the deadline is April 30th, and that is because they originally loaded the physician's form to match our screenings, and our on-site events are going on through the month of April. I have alerted them to that, and they are changing that date to match the program details, which says November 30th, so that will be replaced out there and should be done very shortly. I think they're getting it done yet today, so hopefully that will be replaced out here very, very shortly to match the November 30th date. Yes, thank you. Okay. Can people switch up the order on how they do the screening process? Like, can they do blood pressure before they do the blood draw? And yes, that's a good point. In years past, when we've had the screenings, they've been doing a finger stick because they're trying to run the blood work as they go, and so that way you can have the results immediately as you walk away. In this case, with doing the blood draw, it's going to be a little bit different process because they're going to have to run those lab results to get that more detailed information. So you're not going to have the results from your screening until Bravo sends that results letter, usually about 30 days after the screening. So they can do the blood pressure before they do the blood draw, and in most cases they will do the blood pressure before they do the blood draw, since it's a little bit more invasive blood draw versus just the finger stick. Okay. Yeah. Okay. The question is, if you miss your BMI with Bravo but still meet it with the coach, will the coach notify Bravo? And yes, to an extent. Here, you miss your BMI with Bravo, you can work with the coach to correct that, and the coach will be able to sign off on the appeals form that you submit Bravo to go ahead and achieve that, and the coaches here can work with you on that. But one thing to consider is that you only have to meet 3 out of 5. So if you miss BMI but you are good on everything else, you would still achieve your incentive without having to do the alternative process. Both you and your spouse work at UMB. Do you select employee-only coverage or employee plus spouse coverage during the registration process? You would select according to how you're enrolled. So if you're enrolled together on a plan, then you would enroll as employee plus spouse coverage because you're enrolled together. If you're enrolled separately, like each of you is enrolled in employee-only coverage, then you would select employee-only. So your experience, again, and you both work here would be exactly the same as someone who doesn't have both spouse working here. The question is, this is only for spouses on UMB's medical plan, correct? And that is correct. We're only looking for spouses or domestic partners to participate who are currently enrolled on our plan. So yes. Mm-hmm. Come on site for the screenings. Absolutely. We've offered that the last couple of years that spouses could come on site. We don't have a lot of people take us up on it, but absolutely they can come on site and do the screenings on site if they would rather, or they can go to their physician if it's easier. Mm-hmm. Do people on long-term disability affect our plan costs? And this is a complicated question because technically they don't but they do because they're on COBRA, and our COBRA plan is kind of like carved out and set over here to the side. But someone who's on long-term disability, we first evaluate what their return to work looks like, because in some cases they could be coming back fairly quickly. In other cases, it's undetermined how long they could be gone. So in a case where somebody's going to be coming back fairly quickly, they don't truly move to an LTD type of state because they're going to be returning within a reasonable amount of time. For someone else where it's undetermined how long they'll be out, we would have them be an active associate because they're not able to work, which puts them onto our COBRA coverage. And COBRA is kind of carved out to the side that it is still an expense to us, but it doesn't necessarily affect things the same way as an active associate's coverage does. Other questions? Okay. Well, please feel free to reach out to me if you have any questions after today. Feel free to reach out to me directly or email our benefits mailbox, oebenefits@umb.com. I'm more than happy to answer any questions of anybody through the process. And thanks so much for your time today, guys. Have a great day.